I'm Aidan South and I'm Deputy Clinical Director for South Western Ambulance Service, and my role is to ensure that every patient receives the very best possible care within the organisation. If we look at ambulance education a decade ago, it very much focused 100% of the training on 10% of the workload that we actually saw around the end that you see on telly with the cardiac arrests and the road traffic collisions. And actually we found as an organisation that didn't really match the caseload that we saw in practice. So part of our work has been the implementation of emergency care practitioners that undergo an intensive higher education course to enable them to deal with a much wider range of patients. And we look at the typical emergency care practitioner using over 60 drugs and to leave them at home appropriately. And that's really been the shift of our focus.
I'm James Wenman, I'm an emergency care practitioner for South Western Ambulance Service. My job is to predominantly treat patients at home. I've had extra training which enables me to treat minor illnesses and minor injuries. This is great for the South Western Ambulance Service because we are able to treat more patients at home, giving them the appropriate treatment in the right place at the right time. A traditional paramedic would leave a patient at home 40 to 50% of the time, whereas an emergency care practitioner would aim to treat patients at home 60 to 70% of the time.
I think ambulance services are a great example of how you can deliver innovative care in completely new ways out in the community, and I think that's where our benefit is. It's not around racing people to hospital with blue lights, it's around treating them safely and appropriately in their own homes.
Being able to treat patients at home also allows us to free up resources elsewhere. So whereas before an ambulance may visit a patient at home, then convey them to their local hospital, which could take, depending on the area, from anything up to half an hour to an hour and a half, even 2 hours. Being able to treat a patient at home using an emergency care practitioner will enable that ambulance to be free to attend to other emergencies. Sometimes it's frustrating to be able to visit a patient and realise they need very minor interventions, and previously the scope of practice wouldn't allow me to do so. However, now with the extended skills I can treat that patient at home. It's better satisfaction for the patient and better satisfaction for me in my role.
Hello, ambulance emergency. What's the address of the emergency, please? Okay, are you with the patient now? Okay, and we believe that he's potentially having a stroke.
Well, with stroke patients, it's an excellent example that as a profession we're involved from the very early stages actually helping to write the National Stroke Strategy. And from then we've really had a high national profile looking at alternative ways for caring for people having a stroke.
Before, patients used to take almost an hour to go from the front door to have a scan for the brain when someone comes in with a stroke. And when you have a stroke, every minute that goes past, 2 million neurons die. And so every minute counts.
We've worked across the southwest with 11 acute trusts to put in pathways for our stroke patients, where now we're fast tracking the patient in for immediate assessment. We've taken that further locally with the direct-to-CT pathway, where we now completely cut out A&E and we take the patient directly to the CT scanner.
So we now have a door-to-needle time of just 40 minutes, just over half an hour, whereas before that delay would have taken an hour to an hour and a half. So what's the story? That half an hour means the patient is twice as likely to benefit from the treatment. So that's a massive difference. For someone with a stroke, the difference between making a full recovery or being permanently disabled.
I think what makes a good paramedic is being highly skilled in a complete range of disciplines. At one end of the scale, you've got the incredibly poorly patient, a 2-year-old that's involved in a road traffic collision where it's a serious trauma and you've got to think incredibly quickly, be assertive and manage the scene. On the other scale, you've got the 92-year-old that's fallen at home after having a urinary tract infection, and there it's around the care and the empathy, forward care planning and making sure that patient can remain at home safely.
The paramedics have proven time and time again that they're able to deal with emergency treatments very quickly and very effectively and safely. We have been impressed by the fact that speed is in their blood. It is what they do day after day.